Do you struggle in pain and discomfort in your wrists? And by pain and discomfort in the wrists, I might mean carpal tunnel, tendonitis, or just general wrist complaints that haven't been formally diagnosed by a health professional. If you do, and you're an office worker, there's every chance that something that you're doing at your desk may be the cause of this complaint. And the wrist complaint, you might not notice it when you're sitting at your desk. You might notice it when you're playing golf on the weekend, when you're lifting your child up, when you're trying to do a push-up at the gym. Wrist complaints that you feel outside of the office can be caused by something that you're doing inside of the office. At the ERGO Collective, we believe that most people's body complaints come from their poor static postures. And where do you do most of those? At work, of course. So at the ERGO Collective, what we will assess is the ergonomic, the postural, and the behavioural considerations of something that you're doing over the course of a 40-hour work week that can cause those wrist complaints. If we can work out what we're doing and we can educate you about that, most people's body complaints will settle down really quickly. So let's go through those sorts of things and see if we can nut out what's causing your wrist complaint to start with, and hopefully you can go back to a pain-free existence. Okay, let's talk about the wrist anatomy and how it's important to maintain good wrist positioning over the course of a 40-hour work week. So your wrist joint has huge amounts of range of motion through it. It can flex, it can extend, it can rotate, it can deviate left, and it can deviate right. Wrists like to be straight. So when you look at your forearm and your wrist going into your hand, your wrist likes to be straight. Wrists hate any extensive deviation. They hate any excessive extension, and they hate any excessive rotation. If you're struggling with wrist complaints, what I would encourage you to look at is the positioning of your wrist over the course of the day. When you sit at your desk, what should happen is your wrist positioning will generally be governed by the elbow positioning and the hand positioning. So when you sit at your desk, your shoulders should be completely passive. You should have a 90-degree angle through your elbow, and your wrist should sit square and straight when you use the keyboard or the mouse. This is a great position to be in because it's actually a really stable position for the wrist to be in. When you're in a stable position, it means that there's not much muscle input that's required to maintain this position over the course of the day. What happens in terms of wrist complaints is that wrists hate when elbows leave sides, because all of a sudden you create this angle through the wrist joint that the wrist doesn't like. So when you're in this sort of unstable positioning, what the body will unconsciously do, it will engage muscles to try and normalize the angle through the joint. So as soon as your elbow leaves your side, your forearm muscles will engage to try and bring this back. So if you struggle with golfer's elbow or tennis elbow, have a look at your elbow positioning relative to the wrist, because there's often a component of that in this. The other thing where people run into trouble with wrists is hand positioning, and that's when we start to get lazy. What we tend to do is we tend to anchor our forearm or right near our wrist on the desk, and then we start to use our wrist, our hand for the mouse or the keyboard, and we just kind of pivot around our wrists. This creates, again, really poor loading through the wrist, and the muscles in the forearm will engage to try and sort that out. So if you do struggle with things like carpal tunnel, I would encourage you to make sure that you're not extending through this wrist by anchoring on the desk, and make sure that the wrist is always in a straight, stable position. Let's talk about some ergonomic considerations when it comes to wrist complaints. The first one we want to discuss is when you have the mouse too far away from you. As you can see in this video, reaching for the mouse when it's too far away from you puts your wrist in this really extended position. So it's really important that when you are using the mouse that you keep it nice and close and nice and tight into you, so that your elbow basically never leaves your side. Having a low chair is one of the biggest causes of wrist complaints. The reason being is when your elbows sit lower than the desk, what tends to happen is you do one of two things. As you can see in this video, I'm leaning my forearms on the desk, and this can lead to just deviation and pressure through that wrist. The other thing that we do to accommodate a low chair is that we can chicken wing our elbow. And again, this puts this deviation through this wrist when the wrist is predominantly wanting to be in a really straight position over the course of the workday. So do check your chair height and make sure that your elbows clear the height of the desk, because this will allow you to maintain that nice straight wrist position. Similarly, the keyboard position is very important when it comes to wrist complaints. As you can see in this video, when the keyboard is too far away from you, it puts your wrists into this horribly extended position, and this can cause you carpal tunnel every single day of the week. A bit of a follow-on from the chair height being too low is the armrest can often get in the way. Most armrests are really poorly designed in that they're either not adjustable or that they're simply too big. What tends to happen is we tend to accommodate the poorly designed armrests by putting our chair down low so that we can slide the armrests underneath the desk. The problem with this is similar to when your chair height is too low, is that your elbows now sit lower than the desk. So what you either do is you lean your wrists on the desk from a lower height, or what you have to do is chicken wing your elbow to get over that height differential. Armrests are definitely a consideration in terms of wrist complaints. Another ergonomic consideration is the trackpad on a laptop instead of using a mouse. So you can see the awful angle that my wrist is in while using the trackpad. So it's really important if you do use a laptop to get yourself a secondary mouse, because that way you can maintain nice straight wrist mechanics while working all day. Another indirect posture that can come into wrist complaints is when we side shift while sitting at a desk. As you can see in this video, the further left that I go, the more I have to chicken wing and reach with my right arm to keep my hand on the mouse. This is really problematic for wrist complaints because as I go left, the angulation through that wrist joint becomes more and more pronounced in my right hand. It's really important that you consider your torso alignment when thinking about wrist complaints. Another postural consideration when you're talking about wrist complaints is when you collapse into your rib cage. Similar in terms of leaning your wrists on the desk, as soon as you collapse into your rib cage, you lose a couple of inches of height, which means your elbows now sit lower than your desk. And as a result, what we do is we have this predisposition to then lean our lower arm on the desk and pivot around our wrist. We've talked about how winging the elbow is terrible for wrist complaints in terms of ergonomics and postures. However, there are behavioural considerations in terms of the winging posture. Often what happens with our dominant hand is we can just wing our elbow. As you can see, as soon as we wing this elbow, look at the strain and tension that it puts through that wrist. It puts a lot of torsional stress through that can lead to things like carpal tunnel. What we also do is if we type a lot, often our non-dominant hand and that elbow can creep away from our sides when we type. And for those that do a lot of typing, interestingly, our non-dominant elbow can tend to creep away from us when we do a lot of typing. And again, it has ramifications through to our wrist joints, as it can put our wrist in this extremely rotated position. It's really important when thinking about wrist complaints that we keep our elbows passively by our side. A behavioural consideration that you need to think about is making sure that your mouse doesn't creep away from you over the course of the day, because as we've discussed earlier, it can lead to that really extended wrist position. If you do find that your mouse does creep away from you over the course of the day, I would encourage you to either use a mouse pad, or the other alternative is you can fence the mouse in, which is by putting a really heavy folder at the top perimeter and a really heavy folder on the lateral perimeter, and then you've got your keyboard as the margin on the medial side. And so if you give yourself an A5 area to work within, what happens is you fence the mouse in, so that will take away the predisposition for that mouse to creep away from you over the course of the day. Sometimes we get lazy And that's okay. But how being lazy affects your wrist complaints is what we tend to do is we tend to relax and rest our lower portion of our forearm on the desk. And then what we do is we basically use the mouse and the keyboard and hinge off that leverage point. And as you can see in this video, there's a huge amount of stress and strain going through your wrist because you're actually not using your whole arm to move the keyboard and the mouse. What you're doing is you're putting all the load distribution through that wrist, which puts huge amounts of strain and tension through it. So it's really important that when you do use the keyboard and mouse, you're quite fluid with your arm movements so that the whole arm is moving rather than it's simply pivoting off your wrist. For those of you who use a lot of shortcuts, shortcut positioning can be very effective from a productivity perspective, but what it can lead to is a lot of wrist complaints. So just be really conscious about what wrist position you're maintaining when you're doing the shortcuts. If you do use a lot of them, what we tend to do is we tend to hover in that anticipatory positioning, but by doing that, you've put in this horrible deviation in this wrist, as you can see, and that can lead to a lot of wrist tendinopathies. So it's really important if you do struggle with wrist complaints and you do use a lot of shortcuts, make sure when you're not using the shortcuts that you maintain the wrist in a really neutral position. Mobile phone use and wrist injuries are becoming more and more problematic in terms of office workers. There's a couple of reasons for it. Firstly, mobile phones are getting bigger, and to hold a mobile phone comfortably, especially if you've got small hands, is becoming more and more problematic. The second thing is that mobile phones are getting heavier. Once you put a case on a mobile phone, sometimes the weight of the phone can be quite significant. As a result of these two issues, what we have to adopt are these weird wrist positions to be able to continue to hold the mobile phone. We spend so much time on mobile phones, and if you hold your mobile phone in a strange position which puts a horrible torsional strain through your wrist, it will absolutely end up with wrist complaints. When you use your mobile phone, what you need to make sure is that your hand, your wrist, and your forearm are all in the same plane, and that you hold the mobile phone with a really passive hand. If you can hold a mobile phone like this, there's very little stress or strain going through your wrist, and you shouldn't get any wrist complaints. As you can see, how you sit at your desk over the course of a work week is really important in maintaining really good musculoskeletal health. Fundamentally, in your body, every joint, ligament, muscle, tendon, bone, it's all got a really specific role, and if you use it how it's designed to be used, generally it'll look after you. What we're hoping is there was something in this video that jumped out at you, whether it was a behavioural quirk, whether it was a poor posture, whether it was an ergonomic issue. What we're hoping is one of those things jumped out at you, and if that aligns to your body complaint, there's every chance by addressing this and fixing this, your body complaint will settle down. If that wasn't the case and you're still a little bit unsure, what I would suggest is to continually just check yourself over the course of the day. What is my head doing? Where is my elbow? What are my feet doing? If you can continually check in with your body over the course of the day, you'll actually realize that you have a lot of consistency in terms of your postures and behaviors. And if you can identify those quirks and change them, generally you'll find that your body is in a much better position. If you would like a little bit of one-on-one attention, what I would suggest is booking for a clinical assessment with one of our staff. That way we can go through all fractions of your life to try and ascertain the cause of your complaint. Sometimes it's a little bit complicated and sometimes it's not easy and straightforward. And this is where a formal clinical assessment with one of our staff is probably the best idea for you. At the end of the day, how you sit at your desk affects your body both inside of the office, but actually more importantly, what it does outside of the office. At ERGO Collective, we're your partners in office health.